Hello, my name is Ryan Butler, and I'm a nurse practitioner student at Maryville University, and today I'm going to be conducting my head-to-toe assessment on my patient and volunteer, who I'll refer to throughout this video as B. B is a 26-year-old female who, prior to entering the room, I had her change into this gown and empty her bladder. I also assessed her height and weight. I did a full set of vital signs, and I checked her distance vision using a Snellen eye chart, testing cranial nerve number 2, which is the optic. I washed my hands, and now I'm going to don on these gloves. I'm going to start with inspection of B's head. I note that her head is nice and symmetrical and round. It's normal cephalic. Her hair is thick and brown. There's no signs of alopecia. Her skin is clean and intact with no erythema. I'm going to palpate her skull and note that it's nice and normal cephalic as well. Her ears sit with the outer canthus of her eyes, and they're symmetrical on both sides. Next, I'm going to palpate the facial bones in B's face, noting the frontal, the zygomatic, and the mandible bones are free without any tenderness. I'm going to palpate her sinuses, the frontal, the ethmoid, and the maxillary sinuses are without tenderness or swelling as well. Next, I'm going to palpate the temporomandibular joint. So B, if you could, open and close your mouth, good, and move it side to side. I'm feeling for and listening for any pops or clicks which might be present, which B does not have any. Next, I'm going to have B follow some simple commands for me. I'm going to be testing cranial nerves 5 trigeminal, 7 facial, and 12 the hypoglossal. So B, if you could, I need you to wrinkle your forehead. Okay, squeeze your eyes shut. Good. Puff out your cheeks. Good. Stick out your tongue. Clench your jaws. And smile for me. Very good. Next, I'm going to test the sensation in B's face. I'm going to use this object, so go ahead and close your eyes. Tell me whenever you feel this object brush your face.
Yes. 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 Yes.
Okay, and was that soft or dull?
Soft.
Very good. So her sensation is intact as well. Next, I'm going to move on to B's eyes, and I'm noting that her eyes are symmetrical. Her sclera are clear and white. There's no matting noted on inspection. Her conjunctiva are pink and moist without any erythema or drainage noted. Her eyebrows sit symmetrical above each canthus of the eyes. Her eyelids are normal. They are not turned inward, which would be entropion or ectropion, turned outward. Her eyelashes are turned outward away from the globe, which is normal as well. I'm going to go ahead and palpate her eyes and note her lacrimal apparatus is within normal limits. There's no swelling. Next, I'm going to have B look straight ahead for me. And if you could, cover up one eye for me. Good. And uncover it and cover the other eye. Very good. I'm looking for any strabismus or an astigmatism, which would be any abnormal alignment of the eye or any involuntary rapid movement of the eye as well. I note that there's no ptosis or drooping of the eye. Next, I'm going to use this Rosenbaum chart and have B hold it at arm's length. And could you read the fourth line up from the bottom, please?
4, 2, 8, 3, 6, 5.
Very good. Next, I'm going to have B look straight ahead again for me, and I'm going to take a look at her pupillary response. The light reflex is equal in both eyes. I'm going to do direct and consensual lighting in both pupils, and they're equal, round, and reactive to light. Next, I'm going to use my ophthalmoscope. I'm going to check the red reflex in B's eyes. So just look straight ahead for me. Okay, that's present. And that's present as well. Next, I'm going to move on. And I'm going to test cranial nerve number 3, 4, and 6. So I'm going to have B follow my finger with her eyes. As I do this, I'm checking the oculomotor, the trochlear, and the abducens cranial nerves, which they're all intact. Next, I'm going to move on to B's ears. Again, they sit symmetrical with the outer part of her head. Her skin is clean and intact without any erythema or drainage or swelling noted. I'm going to palpate the auricles They're nice and mobile, but yet firm, and they pop back into place, which is normal. I'm going to come around here behind B, and I want you to cover up one ear for me and repeat the word that I say to you.
Basketball.
All right, cover up the other ear and repeat the word that I tell you.
Caramel.
Very good. So the whisper is intact as well. Next, I'm going to assess B's hearing, which is cranial nerve number 8, which is the acoustic. I'm going to do the Weber test. I'm going to hit this tuning fork, place it on top of her skull, and she should be able to hear the sounds equally in both ears. So tell me if you hear the sounds.
Yes.
Okay. Next, I'm going to do the Rin test. I'm going to place the tuning fork on the mastoid bone, and then when she can no longer hear it, place it by her auricle, and she should still be able to hear the vibrations. So tell me when you no longer hear the sound.
Okay.
And can you still hear it?
Yes.
Okay, and we'll do the same thing for the other side.
Okay. Yes.
Okay, so hearing is intact as well. Next, I'm going to move on and use my otoscope. And I'm going to take a look inside of B's ears. I'm going to pull the pinna up and back, and as I look inside of the ear canal, I'm noting any drainage or erythema that might be present. I'm looking at the tympanic membrane, noting that it's pearly gray. There's no bulging or erythema noted, which would possibly indicate an infection. Doing the same thing for the other side, noting just a little bit of cerumen, which is normal. Next, I'm going to move on, and I'm going to inspect B's nose. I note that her nose is symmetrical inside of, with her face. The skin is clean and intact. The nose is nice and firm. The tip of it is mobile and freely moves. There's no deviations. B, if you could, I want you to plug up one side of your nose and breathe in and out. Okay, and do the same thing for the other side. Good, so her breathing is intact. There's no nasal flaring noted. Next, I'm going to use my pen light. B, could you tilt your head all the way back for me? Very good. And I'm going to take a look inside of her nose. I'm noting the middle and the inferior turbinates are clean. There's no polyps. There's no bleeding. There's no perforations. The septum is midline, and there's no perforations or bleeding as well. And the mucosa inside of her nose is pink and moist. Next, I'm going to move on to B's mouth. I'm going to start again with her lips, and I'm noting that her lips are symmetrical without any flakiness or chapping or anything. Next, I'm going to have B open up her mouth, and as I'm looking in, I'm also noting the breath odor, which is non-malodorous, and I'm looking at her buccal mucosa and the tongue, which is nice and pink and glistening. The floor of her mouth is pink and glistening. The hard and soft palates are pink, moist, and glistening. Her teeth are ivory in color without any cavities, and there's looks like all 32 are there and intact. The gums are intact with the teeth as well. Her anterior posterior pillars are pink and moist and glistening. The tonsils are nice and even without any swelling or exudates on them. Go ahead and say ah. Good, and we'll check her gag reflex. It's intact, so I'm checking cranial nerve number 9, which is the glossopharyngeo, and 10, which is the vagus nerve. Her uvula, like I said, whenever we do the gag reflex and have her say ah, its midline moves up and down evenly. Like I said, the posterior pharynx is pink and glistening and moist as well. Next, I'm going to do active and passive range of motion with B. So B, I'm moving on to her neck. So B, if you could lean your head forward, tilt your head back, and then move it side to side. Very good. And then try to touch one ear to the other. Very good. So active range of motion is there. Try to resist my hand. Very good. Very good. So passive range of motion is there as well. I notice that her neck is midline. It's intact. It's clean. I'm noticing that her skin is clean and intact. The trachea is midline. There's no deviations. I'm palpating the trachea as well, noting that it's nice and firm without any deviations. I'm going to go ahead and palpate the carotid artery one at a time on either side, noting that there is The pulses are equal and strong on both sides as well. Next, I'm going to have B. I'm going to have her take a sip of this water, and I'm going to palpate the thyroid, which should move up and down evenly. Good, it's nice and smooth. Next, I'm going to auscultate the arteries in her neck, and I'm also going to auscultate the thyroid as well. So take a small breath in and hold it. Good. I'm listening for any bruits that might be present as well. Next, I'm going to test the spinal accessory nerve, which is cranial nerve number 11. And I'm going to have B, if you would, shrug your shoulders for me. Very good. And relax. And then push up against my hands. Very good. So that's all nice and intact. Next, I'm going to use the pads of my fingers, and I'm going to palpate the lymph nodes, starting with the occipital, the post-auricular, behind the ears, pre-auricular, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, supraclavicular, inferior clavicular, and if you could lift your arms up for me, we're noting the axillary as well. Again, no nodules or tenderness or swelling noted there as well. Next, I'm going to move on to B's upper extremities. If you could hold your arms out for me, I'm noticing that the musculature is symmetrical. Her skin is clean and intact and symmetrical as well. If you could bring your fingers in, which is adduction, and then bring them out, which is abduction. Joints are nice and movable. Her fingers are, the joints in her fingers are free from any tenderness or swelling. Her joints move freely. Very good. Arms and elbows are all movable without any tenderness noted as well. I'm palpating those joints, feeling for any swelling or tenderness which might be present. There's not. I note that there's no clubbing in her fingers. Her capillary refill is less than 3 seconds. I'm going to note the brachial pulses and her radial pulses are equal and strong in both arms as well. Next, I'm going to move on to the upper or the anterior portion and the lateral portion of B's chest. I'm looking and noting that the AP diameter is less than the lateral diameter. I notice that there's no retractions in her skin, which would indicate respiratory distress. Equal chest rise and fall as she breathes. Again, her skin is clean and intact. I'm going to percuss along all of the lung fields, listening for any resonance which might be there. The lower bases, and if you can hold your arms up for me, we'll check the lateral aspects of the lungs. Very good. Next, I'm going to move on to auscultation of the lung fields. So B, if you could, please. Breathe in and out. Good. I'm listening over the trachea, noting any bronchial sounds. As I move to the lung fields, I should be hearing vesicular sounds, and as I get closer to the bronchial airways, I should hear bronchiovesicular sounds. I don't know any wheezes or crackles or friction rubs, which could possibly be present. Lift your arms up for me. We'll listen to the lateral aspects of her lungs as well. Again, no bronchi or crackles or wheezes noted on auscultation here as well. Her lungs are clean and clear. Nice vesicular sounds all throughout. As I'm also looking at her chest, I'm looking for any thrills or heaves which might be present from the heart, which I don't see anything. I'm going to auscultate her heart and listen to the aortic, pulmonic, the Erb's point, the tricuspid, and the mitral. So S1 and S2 are normal, no S3 or S4 is noted, and no clicks or gallops noted as well. Next, I'm going to have B kind of sit back here just a little bit. I'm going to lay her back here just a little bit at like about a 45-degree angle, noting any jugular venous distension, which I do not note any of that. Go ahead and lay her on back here, and I'm going to palpate her chest for any thrills or heaves which might be present as well, which I don't feel any. B, if you could lay on your left side for me. I'm going to feel for the apical pulse, which is nice and strong and intact as well. So let me go ahead and set you up here again, and swing your legs around here to the front. And we're going to check tactile firmitis. So I'm going to place my hands on your chest and just say 99.
99, 99, 99, 99.
Very good. So if you could go ahead and swing on back here, we're going to take a look at your back side. We can move your hair off to the side here so we can see your back. Go ahead and lean forward and cross your arms over your chest just a little bit. Very good. I'm noting that allows the scapular portion of her body to open up so we can really see her back. Her cervical spine and her lumbar spine are midline and intact. Her skin is clean and intact and symmetrical on both sides. The thoracic configuration is equal and symmetrical on both sides as well. I note again that her respirations are equal, chest rise and fall. Nothing is abnormal. I'm going to percuss along all of the lung fields again, listening for resonance, which is all there. Very good. I'm going to palpate and percuss the costovertebral angles, noting any tenderness or swelling there. B?
No.
Okay, very good. Again, her spine is midline and symmetrical all the way up and down her back. I'm looking for any kyphosis, which she does not have. Any S-shaped curve, which would be scoliosis. I noticed that her lumbar spine has just a slight concave contour to it, which is normal. It's not overly concave, which would be lordosis. Next, I'm going to grab my ruler here, and I'm going to check for diaphragmatic excursion. So B, if you could take a big deep breath in and hold it for me. Okay, we'll mark that point. Same thing on the other side. Okay, let your air out. Breathe normal for just a second. And then whenever you can, let all the air out and hold your breath again. Okay. Percuss up from those points that we marked. Very good. All right, you can breathe normal, and we're going to check. Normal diaphragmatic excursion is anywhere between 3 and 5 centimeters, and B is right at about 4 centimeters, so she's within normal limits. That's checking diaphragmatic excursion. Next, we're going to check tactile firmitis. So B, again, if you could say 99.
99, 99, 99.
Okay, equal vibrations all throughout the lung fields, which is normal. Next, I'm going to auscultate all through her lungs on the posterior portion of her back. So again, breathe in and out. Again, I'm checking for any, I'm listening for vesicular sounds. I'm listening for any crackles or wheezes which might be present, which she does not have. There's no friction rubs, again noted either as well. All right. B, if you could, go ahead and let's lay you on back here. And we're going to pull the gown up. We're going to inspect B's abdomen, noting the contour of her abdomen is nice and flat. I'm going to use tangential lighting to look at her stomach as well. Because she is thin, there is just a little bit of an aortic pulsation, which is normal. There's no abnormal bowel movements, which would indicate possible bowel obstruction. Next, I am going to come around here. I'm going to go ahead and grab my ruler because I'll be using that in just a minute. After inspection, like I said, her skin is nice, clean, and intact. I'm going to auscultate all 4 quadrants of her belly, listening for any clicks or gurgles which might be present, which would indicate to me that she has normal bowel movement, which they're all there. Next, I'm going to auscultate her pulses, so aorta, and then left renal, right renal, okay, left iliac, right iliac, left femoral, and the right femoral. Very good. Next, I'm going to move on to percussion of the entire abdomen area. I'm listening for tympani throughout each quadrant, noting any abnormal bowels, which she does not have. I'm going to percuss for splenic dullness, which she does not have, and I'm also going to check the liver borders. So let me grab my pen. Okay, we'll mark that point, come up to mark the lower border, and mark that point as well. Normal liver border should be anywhere between 6 and 12 centimeters, and B is at about 10 centimeters, which is within normal limits. Next, I'm going to move on to palpation of B's abdomen. I start with light palpation, looking for any tenderness or grimacing in B's eyes, and this also allows our patients to get kind of used to our hands if they're a little ticklish as well. Next, I'm going to move on to deep palpation, feeling for any abnormal organs which might be enlarged, which she does not have. I'm going to palpate her liver, palpate her spleen, and then the left kidney and the right kidney, which is normal as well. Next, I'm going to have B go ahead and kind of sit on up. And as B sits up, I'm looking at her abdominal muscles to note that they're equal and symmetrical and intact as well. Next, I'm going to move on to B's lower extremities and look at her legs. Her legs are nice and pink. Her legs are warm to touch. Her legs are shaved, but if they had hair on them, I would note that the hair distribution is equal as well. I'm noting that the musculature in her legs is nice and symmetrical as well. There's no gross deformities. I'm going to palpate the pulses, popliteal, which are equal and strong. I'm going to come down here and I'm going to test the dorsalis pedis in both of her feet, equal and strong, and palpate the posterior tibial arteries in her right behind her ankles, and those are equal and strong as well. Next, I'm going to test the neurological system. So B, if you could give me your arm here real quick, and I'm going to test the brachial. Good. Test the brachial. Very good. And I'm going to come around here. We're going to test her knee reflex. Okay, that was intact. And that's intact as well. And now we're going to test the Achilles. Very good. It's intact. Foot does move, which is intact. Very good. Next, I'm going to test B's cranial nerve number 1. So if you could close your eyes for me, and I want you to smell this. What does that smell like to you?
Apples.
Okay, very good. So olfactory cranial nerve number 1 is intact, and go ahead and take a sip of that and tell me what that tastes like. Is it sweet or is it dull?
Sweet.
Okay, good. It's sweet. So her taste sensation is intact as well. Go ahead and close your eyes for me real quick. Tell me if you what you feel. Is it sharp, dull, or soft?
Soft.
Okay. Is this sharp, dull, or soft?
Dull.
And is this sharp, dull, or soft?
Sharp.
Okay, very good. I'm going to check B's 2-point discrimination. So keep your eyes closed again for me, and tell me, do you feel 1 or 2 objects?
2.
Okay. Do you feel 1 or 2 objects?
1.
Very good. Next, I'm going to test B's muscle strength in her legs. So if you could go ahead and stand up for me. If you could do a squat for me. Very good. So the musculature is nice and strong. If you could turn sideways for the camera. Very good. And then lean forward for me. Good. Nice and symmetrical. And lean back a little bit. Check your strength in her back muscles. Those are equal and strong as well. Go ahead and squeeze my fingers as tight as you can. Good. Those grips are equal and strong as well. And then I want you to, if you could, raise your leg out to one side. Good. Do the same thing for the other side. Very good. And then bring your leg forward and back. Good. And do forward and back again for me. All right. Go ahead and lay down for me. And we're going to check range of motion in your knees real quick. So we'll go up, back, down. Very good. And then up and back, down again. Very good. Go ahead and have a seat up here for me if you would. Any tenderness or pain noted anywhere on inspection?
Nope.
So again, as we lean forward, we notice that her hips are nice and equal and symmetrical. She was able to move freely with active range of motion. Patient has no complaints of any pain or anything, and that completes our head-to-toe assessment. Thanks for watching.